Hello everyone, I'm Dr. Devika Chopra. I'm a consulting obstetrician and gynecologist practicing out of my own clinic, Hope Clinic at Tarde. UTI in pregnancy. Many patients come to me with certain symptoms during pregnancy which can be mistaken for pregnancy symptoms itself, but they don't know that they could be having a UTI which is asymptomatic. Why does UTI occur in pregnancy more commonly? First and foremost, it's because pregnancy is a diabetogenic condition. That is, your sugar levels are slightly higher during pregnancy, which obviously makes the urinary sugar slightly higher. That makes patients a little more prone to having UTIs in pregnancy. Also, during the second half of pregnancy, the baby's head presses against your bladder, which causes the release of urine, that is the escape of urine from your urethra, a little more difficultly. So the patient is not able to pass urine fully and there is stasis of urine. So there's a condition in our medical terms which we called asymptomatic bacteriuria. That means a patient is having a urinary tract infection, but she doesn't have the symptoms of the same. That's why, as gynecologists, we prescribe urine tests in every trimester of pregnancy. That is essential because many times patients are harboring bacteria and they don't know about it. Why is this dangerous, you say? This is dangerous because an asymptomatic urinary tract infection can spread very fast in a pregnant woman. Because of the stasis of urine and the back pressure created by the urine that is collecting in your bladder, the urinary infection can spread to your kidneys. And from your kidneys, it can spread to your body and it can cause something known as urosepsis. Despite this also, it can also cause premature delivery of your baby. So that's why to diagnose a urinary tract infection during pregnancy is really important. So what are the signs and symptoms? The first sign and symptom is that the patient feels like going to pee very often. She feels that every hour she has to go 2 to 3 times. And even if she's going to pee, once she finishes urinating, she doesn't feel that her bladder is empty. So what we call this as frequency and urgency. Of course, there can be burning or certain red discoloration of your urine, which can be also signs of a urinary tract infection. Patient can also get fever with chills. That means that the urinary tract infection has spread from your bladder and it has gone upwards to your kidney. So these conditions require admission and antibiotic therapy. So whenever a patient comes to me with a urine report showing that she has pus cells, bacteria, RBCs or nitrite positive, in that patient I tell them first you do a urine culture sensitivity. Now why is the culture important? The culture tells me what kind of antibiotic I need to start for the patient, means what the bacteria in the urine are sensitive to. Many a times if we start a particular antibiotic, the bacteria may not be sensitive to that antibiotic and the medication will not work. That's why it's essential to get a urine culture sensitivity if your urine is showing that you are having bacteria. What is the treatment usually and how to prevent it? Hydrate yourself. I know many pregnant women do not want to drink water, especially because they may have to use the toilet again and again. But hydrate yourself, that is the number one thing that I tell my patients. And avoid very sweet foods and avoid caffeinated products. This is something that is really good because if you're taking more of caffeine during pregnancy, again, you will want to go again and again to the washroom. And lastly, have a healthy diet. That cannot be underemphasized or overemphasized. The patient always needs to follow a healthy diet. Medication, as I said, the doctor will prescribe to you based on your culture sensitivity. And you should visit your doctor every trimester and you should get a urine routine done every trimester, even if you're not having the symptoms of a UTI.